Welcome back. We're here with another episode of Skinfluence. I'm your host, Dr. Dustin Portela, as always joined by my co-host, Austin.
I'm Austin Lee, physician assistant, and happy to be here to talk about some of the old things that we used to hear about people do, and we do know more.
Yeah. I've wanted to do this episode. Last year, I read our new FDA director, Marty McCary. He wrote a book called Blind Spots.
Okay.
And it talked about some of the problems that we've had in medicine because we've learned better things. And one of the things he talked about was like avoiding peanuts for kids and how that led to an explosion of peanut allergies.
Totally.
Clearly, it was the wrong call in hindsight. In the initial, move towards avoiding peanuts in kids was not really based on evidence.
Right.
And it got me thinking, what have we done in dermatology that was not based on evidence, but might have seemed like a good idea at the time?
Yeah.
And clearly we know now it was not, because although dermatology is a great field, mistakes have been made.
Mistakes have been made. People have suffered.
Yeah.
And well, we have quite a few things to discuss then.
Yeah.
But have you experienced anything like firsthand that you've seen where you go, why are we doing this?
Oh, that's a good question. Nothing comes to me off the top of my head, but I have seen the results of some of the things we're going to talk about today. Patients that had some of these things done to them in the past.
Okay.
And now they suffer the consequences years later.
Okay.
So
awesome.
It's it's unfortunate. But the biggest question is what is our blind spot today? Like, what are we doing that we will find out in 20 years? It's like, oh, that was terrible. Can't believe we did that. What am I personally putting patients through that, according to the evidence we have now, seems great, but could have harmful consequences? And I think that's why it's important in medicine that we always keep an open mind, that we are, monitoring for side effects of medications, that we're reporting them to the FDA or the pharmaceutical companies. And, one of the things I've become aware of recently is one of the medicines that we use for eczema. In some cases, there have been some patients that have developed CTCL after using it for many years.
Sure.
And so that's something that's being investigated. Is this causing it, or were the patients misdiagnosed in the beginning?
Right.
Did they have CTCL? That's a lymphoma of the skin the whole time.
Right.
Or, what's going on. So there's things that it's important for us as doctors, as physician assistants, as healthcare providers in general, we have to continue to be humble and know that we don't have everything perfect.
Yeah. I will say, when I first started practicing medicine, that was an issue. Is you come out of school, you get trained in dermatology, and you feel like you know better. Mm-hmm. And I would get frustrated at times when patients would push back. And then I learned more of the art of medicine is you're working with a person. They're not just here to do everything you say, and everybody's different and responds differently. So, yeah, that's kind of an interesting thing to not think you know everything.
Right.
Yeah.
When you start medical school, I've heard this story from others. I think they told it to us when we started medical school as well, is half of what you learn in medical school is going to be wrong. We just don't know which half.
That's amazing.
So, well, let's jump into kind of the first thing. Is it's not strictly dermatology, but the dermatology and beauty field as a whole. And one thing is, there used to be a lot of like mercury and arsenic in cosmeceuticals.
Which is wild.
Right.
Now, looking back, it seems wild. But what's the issue with mercury and arsenic?
They're natural, right?
They're natural.
They're natural. So mercury and arsenic were easy to come by. They worked well in the formulations, but obviously they're incredibly toxic. Mercury goes right through the skin, poisons the central nervous system, and it leads to, Mad Hatter's disease.
Yeah.
Did you ever listen to the podcast Serial?
No.
I think it was called Serial, but it went crazy. Maybe it's not Serial. I don't know. We'll find it. But it was this like murder mystery where this guy was messing with mercury all the time, and he ended up dying of mercury poisoning. Spoiler if you have not listened to it. But the big controversy was everybody thought he was rich and that he was hoarding gold on his land and everything. But it was kind of a twist at the end of the podcast series, because he took his own life and nobody understood why. But it was because he was smelting mercury and doing all sorts of weird things in his shop. And So that's just the most recent example of mercury poisoning causing somebody to go crazy. But it was used in a lot of creams to help lighten the skin.
Yeah.
So we obviously know better now, but this was used for years and people had bad consequences from it.
Totally. Yeah, mercury can be very irritating to the skin as well. So I'd imagine if they're putting these creams on their skins, burning is probably one of the main side effects of that. But that's really interesting. Another one that we've heard about are X-ray treatments for acne and for your hair. What were they trying to achieve by using X-ray? It
was not uncommon many years ago for dermatologists to have superficial X-ray in their office, and it was like a broad lamp type thing. And if you had really bad acne, you would lay under it, and they would give you an X-ray, like a dose of radiation to the face, and it was amazing for acne.
Yeah.
It cleared their acne because it's like frying the oil glands.
Totally.
And if you had unwanted hair, they could do X-ray in that area, and it would, of course, kill the hair glands. You're hitting it with ionizing radiation. People were getting great results with acne. However, obviously, that is ionizing radiation, meaning it's going to damage the DNA and increase your risk for cancer.
Totally.
And I have personally seen patients who back in the 40s and 50s went through X-ray treatments for acne and have had hundreds of skin cancers on the face now.
That's wild.
Yeah.
Yeah, were those machines back then, were they just kind of like they weren't targeted, I'm assuming, to the face. They were just blasting.
Yeah, just broad. Yeah,
just
it wasn't
a broad panel.
Pinpoint or anything. It was just
that's crazy.
Laying there and getting a dose. I rotated through an office in residency of a very old dermatologist, super nice guy, but they still had something called Grenz ray therapy, which is like lower dose. And he would use it for eczema and stuff still occasionally. And I was like, I don't know about this, but he got good results with it. But then what's the consequences? It's not as strong as X-ray.
Yeah.
But I got to imagine there's some consequences.
There's got to be consequences. The sad thing is they're going to come like later in life for these patients, and he's going to be long gone. Long gone.
Yeah.
Interesting. It's evolved over time though. Now blue light was a thing now. So instead of using X-ray, we're using different forms of energy to try to treat acne and cosmetic things in a safer way.
Yeah. There's lasers that have come out that target the oil glands. I think their wavelength is somewhere in the 1700 nanometer range, and they heat and selectively target the oil glands, but they're no ionizing radiation. And the results have been pretty good for people. And so we imagine, because there's no ionizing radiation, this isn't going to cause long-term consequences for people.
Right.
So sun lamps were another thing that obviously, in dermatology, we're like, vampires in the medical world. We stay out of the sun. But
the palest specialty.
Yeah. It used to be that, sun lamp therapy was sometimes recommended by dermatologists. A lot of people had them in their home.
Totally.
And we know better.
We now know better. Probably used in psychiatry.
Yeah.
A little bit. Yeah. To help with maybe depression, things like that during the wintertime if you lived in areas that get inversion.
Yeah.
But we know better. I mean, there's still versions of sun lamp therapy going on. We call it tanning beds.
People have sun lamps, tanning beds in their homes sometimes.
Yeah.
And obviously, again, increasing the risk of skin cancer, leading to premature aging of the skin. So that was a thing that has definitely fallen by the wayside.
Yeah, for good reason.
Yeah.
Another thing that was used previously, and it was still around when I started practicing, is coal tar. There are other harsh acids that were used as well, but coal tar being a very popular one.
Yeah. So coal tar was used for patients who had eczema, primarily for psoriasis, because simply putting it on the skin really helped psoriasis. And now, if it wasn't properly refined, obviously there could be some toxins in the coal tar.
Yeah.
But medical grade coal tar generally pretty safe, but it's really stinky. It's sticky. It's not fun to use. But there was a therapy that was pioneered at the Mayo Clinic called Geckerman therapy, where patients with psoriasis, they'd be admitted to the hospital. This was before we had even methotrexate for people to take. Yeah. And if you had bad psoriasis, you would get admitted to the hospital and do Geckerman therapy, where they would cover your body in coal tar, or at least put coal tar on any place that you had psoriasis, and they would put you under UVA light.
Yeah.
So that's what Geckerman therapy is coal tar and UVA light.
Interesting.
And it works really well for psoriasis.
I would imagine.
But can stain the skin, stain the clothing, stinky, sticky, and it's not like
you have to be admitted to the hospital.
Yeah, you're admitted to the hospital. You can't I'm going to go get my Geckerman therapy at lunch today.
Yeah. So that's what you're doing that day.
So it's not necessarily something that is toxic in and of itself at this point, but we use kind of modified versions of coal tar still in dermatology. I think you've talked about T-gel shampoo.
Yeah, I use it very regularly.
Yeah.
Because I get a little bit of maybe SIBO psoriasis on my scalp. And so I'll use that, let it sit, and then my wife complains about the bathroom smelling bad, but it works.
Yeah. I tried a new sulfur face wash recently, and I overall I think sulfur is underused in like acne and rosacea treatment. Yeah. But it just has such a smell to it.
It does not smell good.
And for a couple days I could still smell sulfur even though I'd like showered again. And rinsed, yeah. And then I had to just wash the towel because the towel that I dried my face off, it was just like stinking up the bathroom. And this is a brand that I really like. And many companies that are coming out with sulfur treatments now, they're trying to mask the smell a little bit. This one just did not do a good job.
Ah, that's too bad.
Yeah.
Yeah. Don't go on a date and wash your face with that, I guess.
Yeah, exactly. So phenol peels are another thing that I think they used to be done a lot more. And, in the early days, I don't think they appreciated the risks that can come with a phenol peel.
Yeah.
So phenol can still be used, and in some places it is used. I would still contend that a well-done phenol peel is the best non-surgical way to rejuvenate the skin on the face. I think it's better than CO2 laser.
Yeah.
It works so well, but phenol does get absorbed through the skin.
Totally.
And if you are doing a full face phenol peel, you have to be hooked up to a cardiac monitor.
Yep.
Because it can affect the rhythm of your heart. And there are cases. Even last year in Brazil, there was somebody that died while getting a phenol peel.
No kidding.
And so if you're just doing a phenol peel around the mouth, the area being treated is small enough. Generally, you don't have to do cardiac monitoring, but it is a really aggressive peel. It can lead to permanent scarring if it's not done well. There are cardiac risks to it. So most dermatologists don't do it. They don't want the liability.
Yeah.
They don't want to have to do in-office cardiac monitoring and have a crash cart available. But there's a couple of there's a few places in the U.S. where they do it, and they're really good at it. They have all the equipment and material, and their lectures and they put the before and afters on the screen. It's just amazing work.
Yeah, so that's interesting. But the risk versus the reward, I guess, is that
so if you're going to ever have a phenol peel done, you got to go to somebody who has done a ton of them and knows what they're doing. Like you don't want to be the first case somebody's done. Like ask, do you guys have a crash cart? Like, am I cardiac monitoring? So
that's the right questions there.
Yeah.
Yeah. Well, another one that I still hear in clinic fairly often is, I stopped eating chocolate, but my acne is still here.
Yeah, this is kind of in that cosmeceutical world, but there's just a lot of misconceptions about acne, and I think consumers are a lot more informed than they used to be. And so it used to be longer ago, it was much more thought that diet and bad hygiene were the causes of acne, but we've certainly learned better now as studies have been done and more evidence has come out. So,
yep. But we still combat that every day, where people come in thinking, I'm doing everything right. My acne's still here, and that's just, it's not from the foods you're eating very often. It's a genetic issue of the oil glands that we're fighting against. So, another one. Talk to me about the no moisturizer myth.
Yeah, this one I wanted to include. It's not necessarily a dermatologist thing. Like I don't think this is something that dermatologists are advocating for or getting wrong, but it is something that in the skincare world at whole right now, there's people who think that you have to do like this caveman skincare routine to reset your skin and go back to just doing things the way they used to be, and they're not using any moisturizer. And there's people who are doing this who have really bad eczema, and they think that they've overused topical steroids, which in some cases they have, and they have topical steroid withdrawal. But then to go completely on their other end and not use any moisturizer, that's going to reset your skin, I just don't think the evidence backs it up.
Yeah. I mean, there are people that lack ceramides in their skin.
Yeah.
They're just not going to retain water. That barrier is going to be not going to function properly. You need to be putting moisturizer on.
Some of the extreme cases I've seen on this, with people posting on social media, like day 43 of my no moisture therapy, they're also intentionally trying to stay dehydrated. They're not even drinking enough water. And I just don't even know where the evidence or the idea comes from.
What's the purpose behind that then?
They think it's going to trigger your skin to like fix itself somehow.
Oh, you're saying, okay, like we're going to deprive it a little bit so that way your body's mechanisms are going to try to,
And I just don't think there's any evidence for such a thing.
Not a lot for like primal style things.
Yeah.
Is what I've noticed, but
yeah.
What about some electrical beauty devices? Have you heard of any that were used previously that we just say never use that? That was a bad idea.
I'm not aware of a ton in the field of dermatology that were used, but people are using them now. So I think this is something that's happening now. People are getting their own, cheap plasma pens off of Amazon or Alibaba or something, and they're using them to remove their own skin tags at home or like do their own little facelifts, plasma pen style. And so I think this is a current blind spot of some consumers in the dermatology world of doing procedures at home with some of these devices and pens. I've seen microneedling devices being sold on some of these websites that can go 3 millimeters deep in the skin.
Oh my gosh. Yeah, that's wild.
It's not just the stamping or derma rolling. It's like full on microneedling.
It's penetrating your skin at that point.
Oh, absolutely. Pinpoint bleeding and everything. So
that's wild.
Yeah.
Yeah. Know what you're buying.
Yeah.
Know the risks involved.
Another thing is lightening creams from like foreign sources. So I've seen people that they're on vacation in Thailand or something, and they buy lightening creams over the counter, and the regulations for pharmaceuticals are wildly different in different countries.
Oh yeah.
And it's in another language. You can't really see what is on there. And so I've had patients come in and they have like worsening pigmentation on the skin. And so I'll pull up the Google Translate app on my phone, and you can just literally hover over it with your camera and it'll convert it. And it's got like hydroquinone at like 12 to 20% that they've been using for months. Often has straight up clobetasol in it too.
No kidding.
Yeah. And so they've been using like clobetasol and high strength hydroquinone on their skin, and they've developed ochronosis. Yeah. And that is permanent hyperpigmentation. Like it's really hard to treat. And so that is another thing that we can go down the hydroquinone rabbit hole. Like this was a great ingredient to treat pigmentation, but there's so many options out now. Yeah. I don't think you should buy anything over the counter with hydroquinone.
No, I've been trying to dissuade people from that for years and years because even the over-the-counter strength in the U.S. just isn't really sufficient, and you end up overusing it over time, and it's just not going to do very much for you.
I still think it has a place, and I do like higher percentages, but when I prescribe it for a patient, we're giving them a limited supply with no refills. Yeah, because I don't want them to be able to use it for longer than 3 months. Yeah, so. But that's another one where we've learned that, hey, this was a great ingredient for lightening. Oh, it turns out it can cause problems when you use it too long. Yeah. So I don't know if you have any takeaways from these. My biggest takeaway is that these things were commonly accepted and well regarded at the time that they were being promoted. And we now know better. And it's just that lesson of remaining humble and understanding that we could be doing things now that we'll find out later are problems. And that's why it's important as providers to ask your patients questions, truly listen to them, understand if they're having any problems, monitor for side effects. Yeah.
One of the things that I've kind of tapped into is patients know their bodies very well. They know they'll have hunches or suspicions about things going on. And it's important that we listen to those suspicions and hunches because sometimes they'll help you catch things that they're not going to catch themselves, but because of the knowledge base we have, we can help guide them through sometimes difficult situations or difficult conditions in a better way. Yeah. It's just, for me, it's been, you come out of school thinking, I know things now. And then you realize very quickly that you don't. Yeah. And that the reason why we call it practicing medicine is because that's exactly what we're doing. We're practicing the art of medicine we're practicing the art of being human with other humans, and things are going to learn and change as technology gets better. And if we're not trying to stay up with that, then at the end of the day, our patients are going to suffer. But if we're looking for true things that science that are being developed scientifically and being tested in the right ways, then they can be a huge benefit to our patients.
Yeah. So with that being said, let's jump into a little Did You Know?
Okay.
Get some fun trivia.
All right, I got an interesting one for you.
Okay, let's hear it.
In the early 1900s, there were some salons that were using mercury chloride as kind of a lightening or freckle remover.
Yeah.
And for those who don't know, mercury chloride, like sodium chloride, is a salt.
Yeah.
That is very acidic.
Yeah.
And it's essentially it could burn away that top layer of skin very easily. And if you look up mercury chloride burns on the internet, it looks like third-degree burns. They are going down to the dermis at times.
Yikes.
So
I bet it would remove freckles.
It removed the freckle. Yeah, for sure. It probably removed the freckle real quickly. It's probably one of those things where they had to put it on and then quickly wipe it away.
Yeah.
But if you do it the wrong way, it could cause some severe scarring.
Yeah, let alone your central nervous system getting mercury.
Yeah, totally. Yeah, you're getting mercury into your bloodstream.
Well, mine is that in the early days of X-rays, we didn't understand that they could cause a lot of problems, and so X-ray technicians, when they were coming in for the day, often they'd turn on the machine and they would take a picture, an X-ray of one of their hands, and just make sure films developed okay. And they would do this for years. And so if you've ever looked up photos of X-ray technician hands from like the London hospital in the early 1900s, like their hands just look like the crypt keeper, and cancers growing all over.
That's
and
wild.
Bony deformities because they're getting weird cancers because every day they X-rayed their hands.
That's crazy.
Yeah. And sometimes like there's a huge difference in their hands because, they just hold the same hand under there every time.
And it's just something you just don't know.
Right.
That's what's crazy.
Yeah. And, I don't think they would ever do this anymore, but I remember when I was a young kid, my brother, he had stepped on a sewing needle that got lost in the carpet. And part of it broke off in his foot. And so we had to go to the family doctor's office. It was a small town. I don't think we went to the emergency room. We just went to the family doctor. So they x-rayed his foot. They could see, the needle's there. We're going to have to numb him and kind of pull this out. And then I was there and I was just watching everything. They're like, "Oh, do you want an x-ray too?" And then they x-rayed my foot just to like show me.
Fun times, everybody.
Yeah. And that was in the 1980s. My children like to remind me I was born in the 1900s. So
yeah.
And so that was in the 1980s. I imagine by then they knew that radiation wasn't always that great. But yeah, I got an x-ray of my hand or my foot just
for fun.
Just for funsies. The doctor must have not had a lot going on that day.
That is hilarious.
So, but yeah, they would x-ray their hands every day and their hands just were trashed.
Yeah, that's wild.
Blind spots in medicine.
Yeah, that's sad.
Well, coming back, kind of continuing on the theme of the lessons learned here, what do we do going forward? Because we've acknowledged there could be blind spots that we have, and we just don't know what those are right now. And so one of the biggest advances that has happened in the field of medicine, let alone dermatology as a whole, is just this trend towards evidence-based medicine.
Totally.
And as for all the criticisms that the FDA, we can throw at it for slow drug approvals or drugs getting approved when there's pharmaceutical interests being served. Totally. Overall, they have, I think, done a good job to improve the safety of medications that are coming out on the market.
Oh, yeah, I'd agree.
Still we have, the opioid crisis. That was very deceptive. Mm-hmm. Vioxx, I think, was another one. There's big problems with. Yeah. But overall, they have improved the safeguards with evidence-based medicine to, one, make sure that things are effective, even though like x-rays were very effective, but also safe. And long-term safety data, registries to follow medications even after they're on the market. I think those types of things have done a lot to help us monitor for the adverse events that could happen.
Yeah. One of the things that we learn in school is how to read research papers. And one of the beauties of evidence-based medicine, the FDA, places like PubMed is everything is published.
Yeah.
And we have access to those articles. We have access to all that research that we can now read and make the decision, is this something that I feel like is going to be can be implemented in our practice, something that can change in the way I practice medicine? Or you could read an article, you could read a study and a paper and say, I don't think they set this up really well.
Right.
Maybe I'll keep an eye on this and see how, the next few years it develops and see what studies come out about it. And so it's a beautiful thing that we as providers get to do that and participate in it and have, with the technology we have, just limitless data at our fingertips.
Yeah. And it's sometimes hard to parse through all that data, but now we're in an era where AI and technology
totally
really is making this easier. And there's obviously everybody knows ChatGPT, Claude, and they have, deep research modes where they have access to some of these databases, and they can go in and they can read studies and they can pull references. In the earlier days, they were hallucinating and sometimes making up references that didn't even exist. But they've gotten a lot better. And then there's been a platform created called Open Evidence. I don't know if you've ever toyed around with this.
I've heard of it. I haven't played around with it though.
Yeah, but it's one of those things that's tied into PubMed and other big databases of research. So if you have a question, and this is something I'm going to try, I had a patient ask me if the medicine that they were on was safe to stay on if their partner wanted to become pregnant.
Yeah.
And so it's not that their wife was taking the medicine, but if I'm taking this medicine, could that be a problem if she becomes pregnant and I'm on this medicine? I'm
Is it mutagenic?
Yeah. So I'm gonna throw that into Open Evidence and see if there's updated guidelines, because I can PubMed and I can maybe find a couple studies, but I don't have all the time in the world to go through every database. And so I think tech is significantly helping. Plus, when you can upload adverse events to the companies, they can track these, and the computer systems can recognize, like, hey, I think we're getting a signal here, like something funny is going on.
Yeah.
But ultimately, it still comes down to astute clinicians that are recognizing things. And I think this was really evidenced well when the water crisis happened with lead in the water in Flint, Michigan.
Yeah.
That it was really a pediatrician in town who led the charge on, like, something is wrong here, because it's routine for pediatric patients to get blood lead levels tested in the first few years of life. And she was starting to see more kids were having higher than normal lead levels. And it was a pediatrician, just an astute clinician that noticed this.
Amazing.
And so, and clearly that was, a huge problem. And I don't even know if they've got it fully fixed yet.
Yeah, I don't know.
So
you hear about it. We move on, but yeah, interesting.
So, and we are in the skincare world now. There's really good resources to help us understand, like, ingredient transparency.
Totally.
So the Inky List, not the company, but the INCI database, you can go on and you can look up ingredients. I would personally stay away from things like Yucca and the Environmental Working Group, because I think there's some ulterior motives there. Yeah. But there's probably a purpose for them, and they might be helpful in some cases, but overall, I'm not a big fan of those.
Yeah, you've talked about it before.
Yeah.
And what's nice is, a lot of people look at ingredients and they think, I don't know any of these words. Yeah. But you can pull your phone out, take a picture, put it on Chat GPT or other AI sources, and it'll go through the whole list and say, this is what these are for, these are what these are for, and it gives you a little bit more an idea of what is in there, what are the preservatives, what are the active ingredients, and that type of thing. Yeah, and I've used this when I've evaluated ingredients before. Is just send in the whole ingredient list and say what in here are common allergens, because not everything is always called the same name. Right. There's different names for ingredients that can be used in different purposes, and so I've found that very helpful. Totally. Just use things like AI to help break this down and understand what percentage of people are allergic to this particular ingredient, and it pulls the studies. And so it's, just to illustrate ways in which we as clinicians are trying to avoid these blind spots and not expose our patients to something that could end up being harmful. Totally. Yeah. Another thing that we have available to us, if you're going to a provider, is personalized skincare.
Mm-hmm.
We're understanding now that there's no broad brush of one-size-fits-all treatments or even just over-the-counter products, because one over-the-counter product can be amazing for one person and then just destroy the skin of another person. And so having the ability to talk through with, a healthcare professional, a dermatology professional, what things should I be putting on my skin based on my skin types and all of that. AI can probably help a little bit if you put in your profile and say, I have this type of skin. Is this product going to be beneficial or going to be harmful, or am I going to be allergic to it? Things like that. But we're definitely moving away from broad, just one size fits all treatments.
Everybody gets an X-ray.
Everybody gets X-ray. You get Vaseline. You get Vaseline.
Yeah. Was that Tyra Banks?
Tyra Banks.
Yeah.
It's one of my favorite videos.
I just saw it for the first time.
Oh, really?
Yeah.
You almost can't believe it's real.
I know.
You're like, people are going wild on that video. If you haven't seen the video, type in Tyra Banks, you get Vaseline, and it's going to make your day.
Yeah. And was that after the Oprah car thing?
I think it was. I think she was trying to keep up.
Oprah gives away a car, you're giving away Vaseline. I'm like,
it's not the
sorry,
same.
Tyra.
We're not the same.
We're not the same. So yeah, that's one of to get back to the art of medicine, and maybe AI will get to this point, but I'm sure that you have had this experience where you're sitting with somebody, you're developing an acne routine, and maybe all day you've been writing the same 3 medications, but you look at somebody and you're like, I think we need to go in a different direction. You're not going to respond well to this one. I want to do this one. Or, the kid with acne, they're going to do Accutane, but you're like, something about this just tells me you're at risk to have a bad purge, and I'm going to put you on prednisone as well.
Yeah.
And that's that art, that's that experience you have to bring to the table, that when, at least at the state that AI is at right now, it's just going to straight up, hopefully just give you the facts. This is what you do. But it can't look at you and have that gestalt feeling, and
they're involved too.
Yeah, be involved in your care. Don't be afraid to ask questions. Don't be afraid to advocate for yourself.
Yeah. Perfect. Well, and then finally, we've been talking a lot about things that we as providers can do for our patients and the art of medicine and things like that. But there's 2 people involved in this dance that we're doing with our patients, and patients should also take charge of their healthcare as well.
Yeah.
Don't be afraid to ask questions in the room and think that we're sitting here as an authority figure telling you what to do. This is a dance, and we're here to kind of help guide you through whatever issues you're finding. So be curious about the medications that your providers are putting you on. It's okay to ask questions and not just accept that this is what we're doing. Ask why. Maybe sometimes you want to do that specific thing. Maybe the provider doesn't know a little bit of your history that wasn't added in the chart or things like that, or you remembered something. Tell them, hey, I had this experience with a similar maybe medication, and we can work through those issues with you. So it's important that patients also be involved in their own care with us.
And you have to advocate for yourself when you don't feel like something's right, or you think you know something. It can be done in a respectful way. I've had patients come and say, I have this, I need this, and I don't agree. I'm like, I don't think that's what you have, and if I give you that, it's not going to work. And sometimes the therapeutic relationship just doesn't work out, and they have to go get an opinion from somebody else. But I've also had patients come in, and I wasn't able to get them better, and they come back, and they're totally better. Their skin is totally clear, and I'm like, what do you do? And they're like, I did some research, and my cousin had tried this, and I decided to give it a try, and I'm clear. And then I file that away as like, wow, that's really cool.
Yeah.
Maybe that's something I can recommend for the next patient that's struggling here.
Yeah.
And so I appreciate when patients can participate in that dialogue and advocate for themselves, and they're curious about finding solutions as well.
Yeah,
so
I agree. It is. It's important for us as providers to listen.
Yeah,
and I think you do that well. So,
but the overall message is, we know science doesn't always get it right off the bat. In general, we try to operate off the best available evidence at any time, but the humble scientist, the humble provider, will be open to evolving science when additional data comes along that proves something different and
Yeah.
changes the paradigm of medicine, we want to be able to adapt to that. And hopefully wherever you're at listening, you have a provider that you're working with for whatever health concerns you have that listens to you and is willing to accept new evidence. And, you know, not to get political at all, but we saw tons of changes back and forth during COVID.
Yeah.
And we saw cases of people taking a hardline stance with no evidence. And we saw people who were following the evidence and were willing to update as the evidence evolved.
Yeah.
And hopefully, you know, I just think that showed a lot about different people and where their brain is at and their ability to adapt and change and improve. And so that's why I love science overall. That if you do it right, things are always going to get better.
Yeah. It's an ever evolving thing. It's never going to be static, and it's a fascinating field. Yeah. And we get to participate in a small way in dermatology, which is awesome.
Yeah. So as we wrap up today, we both want to share one of our favorite products. This is the Alpha Ret from Skin Better Science. And this is genuinely a product that has really solid research behind it. They've won 33 awards over the last 10 years. It's the 10-year anniversary for Skin Better Science Alpha Ret.
Oh, yeah.
It's their best-selling product. It's one of the most popular products in our office. It is retinoic acid, just like tretinoin, but it's combined with lactic acid, and glycolic acid is in the formula. So you get some gentle exfoliation in what is, at least for my skin, has been the most gentle retinol that I've ever used.
And for me as well.
That also gives you results.
Yes.
Yeah, I've used gentle retinols that I didn't think did anything for me.
Yep.
But I like the results from this, and it doesn't irritate my skin. So we will have a link to the Skin Better Alpha Ret and all the products from Skin Better in the podcast show notes. You guys can check that out if you are so inclined. It can be purchased in our office if you're local to Boise, but we know many of you are listening from all over the country, and you can find that through the link in the podcast show notes. So thank you for joining us on this episode of Skinfluence. I'm Dr. Dustin. You can find me on all social media platforms at Dr. Dustin Portela.
And you can find me online at Austin Lee PAC. And if you enjoy this episode, enjoy listening to us talk about dermatology and science and all sorts of things, give us a 5-star review on whatever platform that you listen to the podcast on.